Healthcare in Canada needs to change. I've spoken to patients from across the country suffering on healthcare waitlists and to people who have even lost their loved ones to waitlists. Their stories are heartbreaking, and yet our healthcare systems remain unchanged and unaccountable. We've seen Liberal, Conservative, and NDP governments across the country try to make healthcare work, and yet we haven't seen a single province be able to deliver acceptable care consistently. They've all thrown more money at the system, and yet healthcare outcomes keep getting worse. Meanwhile, overworked and overtaxed families are footing the bill to prop up a failing healthcare system. In universal public healthcare systems in Europe, wait times are measured in days. We measure hours in months or years. The Alberta government is trying to reform its system so that it's more like European systems that have much shorter wait times. For instance, in Europe, patients can choose between using the public system or paying at non-government clinics if they so desire to do so. They have a dual approach, two choices. The Alberta government has announced the same option will be available to patients there. This means those who choose to pay for private services will no longer add strain to the public system. It also means those who cannot afford to pay will move up a spot in line and get faster access. You will hear some falsely claim these much-needed health reforms are American-style healthcare. But a dual model doesn't get rid of the universal public system. It simply adds options. Sweden, Germany, France, the UK, Japan, and Australia, to name a few, all have dual healthcare models like the one being proposed by Alberta. And all of these countries have better performing universal public healthcare systems than we see in Canada. As a matter of fact, Canada, Cuba, and North Korea are the only 3 countries in the world with universal healthcare systems that ban citizen access to non-government clinics. Simply put, the Alberta government is giving up their monopoly on healthcare. It means choice for patients and leaving behind the old archaic model used in North Korea, and instead moving towards a European model. The other Canadian premiers should all take note. Give up the monopoly and put patients first. 59% of Canadians support changing to a dual system. To learn more about other changes the Alberta government is making to bring their healthcare system closer to European models, please visit healthreformalberta.ca.